This module outlines the medications to review when called to see a patient with falls. By the end of the module, you should know what polypharmacy is and know what medications can cause falls. The cause of falls is often multifactorial. Contributing factors may include the environment, certain chronic medical conditions, and medications. Medication use is one of the most modifiable risk factors for falls. Polypharmacy and particular types of medications increase the risk of falls. So polypharmacy refers to the use of multiple medications simultaneously by a patient and is often defined as taking 5 or more regular medications. It is very common in the hospital setting, and at least half of older adults in hospital are taking 5 or more medications. Polypharmacy is associated with an increased risk of falls and other adverse effects. It is also important to remember that polypharmacy is not always inappropriate. The appropriateness of the medications depends on the patient's individual condition and specific health goals. There are particular medications that are associated with an increased risk of falls, particularly in older adults. If you are asked to review a patient with a fall in the hospital setting, it is important to review their medications. Centrally acting medications include antipsychotics, antidepressants, hypnotic sedative drugs, opioids, antiepileptics, Parkinson's medications, and some antihistamines. These medications can contribute to falls as they can cause sedation, impaired balance, and postural hypotension. Most centrally acting medications should generally be weaned slowly rather than stopped suddenly, depending on the dose and the duration they have been taking the medication. Antihypertensives and antiarrhythmics can also contribute to falls if they are causing bradycardia or postural hypotension, so it is important to check heart rate and postural blood pressures, and review of these medications are required. Oral hypoglycemics or insulin can also contribute to falls if they are causing hypoglycemia. Determining the appropriateness of a medication for an individual patient can be challenging. If you are unsure, speaking to the patient's general practitioner, your registrar, or geriatrics may be of benefit. Additionally, there are various deprescribing guides which can provide guidance on the indications for a medication and how to reduce medication safely. In the first instance, reviewing medications when asked to see a patient with a fall, identifying medications that can increase the risk of falls, and stopping or reducing contributing medications can help reduce their risk of falls in the future. For further information on medications and falls, there are various resources and tools such as the Medication-Related Falls Risk Assessment tool.